Good evening, everyone. Thanks for joining us. My name is Deborah Fiasco, and I work at Special School District in the Family and Community Engagement Department, otherwise known as FACE. You might have known us before as Parent Education and Family Engagement, and we combined. So we're a bigger, better team this year, and our new name is FACE. So tonight, I'm going to just give you a little rundown. This webinar is being recorded, so your cameras and microphones have been disabled, but you can ask questions in the Q&A, and then I will ask them for you. Please remember that webinars can't be guaranteed a confidential environment. We try our best, but don't share anything that's identifiable or specific about your family member or your student. If you need any additional assistance, put it in the chat, and the host, which is me, will see it. Closed captioning is activated, and a recording of this webinar will be uploaded within about a week. At the end of the webinar, you will get a short survey that you can take to tell us how you like the webinar and if there's other things that you might be looking for. So the Family and Community Engagement Department has several upcoming events. Today, we had the Productive Living Board, which provides funding for a lot of the opportunities that we're going to talk about tonight, did a lunch and learn, and those are recorded too. So you can go back and watch any of our workshops or any of our lunch and learns by going to our website on the SSD website. So we have some upcoming workshops. We've got another one next week. Behavior strategies for the home and community. We've got building social and leisure skills, and we've got a couple in April, a toilet training one that I think is going to be really good. We also have a family cafe, and that's an opportunity for families to come together and really sit down, form some community, talk through some common interests and issues. And our next one is in March, and we have another one in April. All of our information, again, can be found on the SSD website. The other thing that we have now that we've combined is at the North Technical site, we have what we call the Hub. And at the Hub, we have different opportunities for families to come. We have Castle coming. We still have March, April, and May events where families can come and get a little case management, maybe find out about utility assistance or find out about rent assistance. And we have the Higher Education Consortium. We've got one more opportunity for that on April 18th, where anyone who's looking at higher education can come and ask questions and get information about pursuing higher education. This is the information on our website, and so you will see we do have the 5-question survey at the end. We'll come back to this so that you have our contact information. I'm going to stop sharing now and introduce Tamico Jones. She is the Director of Advocacy. Tell me if I got it wrong, Tamico, at Sunnyhill and the Friends program. She's a wonderful advocate. And I'm so excited to have her tonight presenting about community funding options. So Tamico, I'm going to give it over to you.
Thanks so much. I just want to say first and foremost, thanks for having me. I'm here tonight to talk about community and funded supports, including residential options. So we're going to have an overview over supports available in the community, Medicaid, how to access Medicaid, DMH funded services, a little bit about DHSS funded services, and a little bit about some services through our local SB 40 board, which is in St. Louis County, the PLB, who we were speaking about earlier on this meeting. So first and foremost, I wanted to do a little overview on who I am. So my name is Tamico Jones. I am the Director of Advocacy over at Sunnyhill. And my role in the community currently is as a family navigator. I have a dual degree in elementary and special education, and I have been a licensed administrator for residential care and assisted living. I have over 15 years of experience working with individuals with developmental disabilities and dual diagnoses. I've been a case manager for DMH. I am a community trainer. I've done keynote speaking for continuing education, among other things. I've been a supervisor over ISLs. I've done one-on-one supports for adults who live independently in the community. Currently, I'm a family navigator. I also do CIT training. I do CIT training for local police departments to educate police officers on how to best respond to calls when dealing with individuals who have developmental disabilities or in a mental health crises. And I've also worked in a special education classroom. But a lot of folks in the community know me as Mom to Brock. So the young man that is in that picture is my son, Brock. Brock is 17 years old. Brock has a diagnosis of cerebral palsy. He utilizes a feeding tube. He uses a wheelchair for mobility. He also uses an AuGCOM device for communication. He has a lot of medical support needs, but that's okay. He is my best friend, and he is truly my motivation and my reason for doing what I do. So that's just a little background about me. I like to put that out there, though, and tell people a little bit about my personal life, because I want them to know, the families that I work with, that I truly understand, and I get it. I get it on a very deep personal level. And when families come to me and they talk about how hard things are and the struggles that they go through, I truly understand. I truly understand. While no two people are the same, we have a lot of similar experiences. So starting off this evening, I wanted to talk about what exactly defines a developmental disability. We have a lot of diagnoses and things that we throw around, terminology, but I wanted to get into what is a developmental disability, because the things I will be discussing this evening, having a diagnosis of a developmental disability is key to accessing the supports. So a developmental disability is a disability that is due to one of the following. So we have an intellectual disability, cerebral palsy, epilepsy, head injury, autism, a learning disability related to brain dysfunction, or other mental or physical impairments. Intellectual disability, this is specifically referring to cognitive function. So that would have to be determined via a standardized test, or specifically an IQ test. Not only do we have to have one of those diagnoses, but the disability needs to occur prior to the age of 22. The disability needs to be a condition which is going to continue indefinitely, meaning it's not something that we're going to go get rehab for and then we're going to be back to baseline in 6 months. It's something that's going to continue throughout the duration of the individual's life. And then on top of that, you have to have 2 functional limitations. So functional limitations are self-care, language development, which means receptive and expressive language. That means the ability to understand what's a person's receiving. So when someone speaks, the individual's ability to understand what's being said, and then the ability to express themselves. Another functional limitation could be learning. Another one is self-direction, capacity for independent living or economic self-sufficiency, and mobility. So you have to have the criteria I discussed previously. One of the diagnoses has to occur prior to 22, has to be able to continue indefinitely. You have to have 2 functional limitations. So you have to check 2 of those boxes that are listed on the screen at the bottom here as well. All of those things need to come into place in order to have a diagnosis of what we would consider a developmental disability. The next thing we're going to talk about is Medicaid. So Medicaid is something that we hear people talk about. I think a lot of people associate it with lower income, which is what it is. Medicaid is a federal and state, it's an insurance program. So each state has its own guidelines as far as criteria to qualify for Medicaid. So if an individual comes to us in the state of Missouri who had previously had Medicaid in another state, say one of our neighboring states such as Kansas or Illinois, there is no reciprocity between states, meaning because you qualified in another state doesn't necessarily mean you're going to qualify in the state of Missouri. Medicaid is a low income program. Sometimes a copayment is required. There's also a Medicaid program called a spend down. And what that is it's essentially a monthly premium that you have to pay in order to access your Medicaid benefits. There is an option to have both Medicaid and private insurance. And then lastly, it's important to note that our individuals that are kind of in that transition age as they're becoming adults, individuals who are 18 and older are considered their own household. So when you go to apply for Medicaid, say you have a loved one who is living at home in their what we call natural home with like mom and dad, or maybe siblings are helping support them, and the other individuals in the home are doctors or lawyers, like the people that are helping care for the individual with a disability. And so they would not meet the caregivers would not meet necessarily the criteria for Medicaid. But the individual with a disability, if they are 18 or older, they're considered their own household. So those other people in the home, the mom, the dad, that could potentially be lawyers or doctors or whomever that are above the income threshold, their income doesn't count. So we look at individuals as their own household at the age of 18, which a lot of the people that we support in the community that have developmental disabilities will then qualify for Medicaid, considering they are their own household and only their income and assets count towards their Medicaid application and all of that, that they will likely qualify for Medicaid. So why is that important? So that's important because Medicaid is often the channel for accessing in-home services, DMH funded supports, DMH case management. So we'll get into the DMH case management and DMH funded supports in a minute. But first and foremost, if an individual is needing help in home and they have Medicaid, we would ask that they go through DHSS, which is the Department of Health and Senior Services here in the state of Missouri, to access those supports. So DHSS is the Department of Health and Senior Services, but don't let that trip you up. DHSS supports individuals with developmental disabilities, not just seniors. So DHSS is there, and they have services available through home and community-based services for people who are 18 and older, who have Medicaid, and need in-home assistance. So some of those supports that are available through DHSS include personal care, which is helping take care of the individual. That is bathing, dressing, grooming. There's housekeeping that's available, meal preparation, shopping. Nursing services are available, such as those that are listed, medication setups, blood draws, diabetic nail care. There are some respite services available if there's a caregiver that's helping take care of someone. There's meals that can be provided for the aging. And there's also adult daycare services that are available for individuals through straight Medicaid. It's important to note that if an individual has case management through Department of Mental Health, also known as DMH or the regional office here locally, that in most cases, in order to access some of the DMH funded services, they're going to ask that you have tried the DHSS funded services first. So there's steps, there's processes. And so if you have Medicaid, the funding services through DHSS is a straight Medicaid billed service. So you would call this number down here at the bottom of the screen for a referral, or you can click on, there's a link here at the bottom. You can go online and do an online referral for the DHSS funded supports. So if you have a developmental disability and you checked all those boxes, you met all the criteria we discussed earlier, you are likely going to qualify for case management through Missouri Department of Mental Health. So we often refer to them as DMH or the St. Louis Regional Office. DMH services are available statewide. Here locally in St. Louis County, we are fortunate to now have 2 case management options. Both are essentially DMH funded services. There is DMH, or the regional office as we call them. And there is now a new provider called CHS, that's Center for Human Services. Center for Human Services is a large agency that provides a lot of various supports throughout the central and western portion of the state of Missouri. And they're now here in St. Louis County, and we're really excited to have them as part of our team. They're offering case management services, starting off in the south region of St. Louis County, with the goal being that the current caseloads will be brought down to a much lower level than they're at now, and individuals will be able to have more access to supports. So we're very excited that they're in town, and they're here to help. So DMH is Missouri Department of Mental Health. They have a variety of services and programs available, but the main thing to take away from this is if you have a developmental disability, you have Medicaid, you'll likely qualify for DMH. And in order to do that, you need to go through intake, and you need to access a service coordinator. A service coordinator is also known as a case manager. So you would contact their intake department, and we can discuss later on who to go through to access those supports. So you would go through their intake department. They would do an eligibility screening with you. They will ask for documentation for the disability. So you'll need some sort of diagnostic, IQ test, school records, medical records, stating that the individual has a developmental disability. Once you're determined eligible for services, you will be assigned to a service coordinator. That service coordinator will then reach out, and they will meet with the individual receiving services and any of their support team who they would like to be present, and they will develop an annual plan. That annual plan is called an ISP. It's an individualized support plan, and that plan runs for a year for services. So in that plan, it'll talk about, excuse me, who the individual is, their likes, their dislikes, different supports that they will need, different things they would like to access. It also talks about goals that they would like to achieve by the end of that year. So the service coordinator is basically there to give information and guidance, and they're kind of the gatekeepers for funded services. So when we talk about funded services through DMH, there's a variety of those services. So what is actually available through them? So we talked about case management. So case management is going to be your go-to people to ask questions. There might be something specific that you're in need of, such as maybe access to therapy services. Maybe you need modifications for your home if your loved one has some sort of mobility support needs. So they have these different things called waivers. So you'll hear people in our line of work talk about waiver. Well, waiver is actually it's a Medicaid waiver, and it's funded through Medicaid dollars, which is why it's part of the reason why you have to have Medicaid to even access DMH funded services. So think of the waivers as like a funding stream. There's like a pot of money in the state budget that's like set aside for these services for people. So it's like a funding stream for people. So the comprehensive waiver, we're starting off talking about kind of the top tier level of supports, and then we're going to work our way down to the bottom tier. Okay. So there's the comprehensive waiver. In order to access this high level of support through DMH, you must have exhausted all of your other options and or be in an emergency or crisis situation. So the comprehensive waiver, there's a lot of services available under the comprehensive waiver. There are and this is the waiver that helps pay for residential supports. So this waiver will help pay for individuals to go live in a residential setting called an ISL, and it pays for it. So that's what I've highlighted here. I've highlighted the individualized supported living and group home. These are two, I guess, popular residential options. But these aren't services that you can just kind of flat out ask for. You can't say like, hey, I want my loved one to go to an ISL. There has to be a reason why. You have to justify why your loved one needs that level of support. Typically, you have to have tried other services in your home. So the comprehensive waiver is reserved for individuals who have a very high level of support need. But as you can see on the screen, there's a lot of other services that are available. Some might sound familiar to you, others may not. At the end of this, we'll talk about who's available to explain some of these things to you. I'm not going to get into all of them tonight, but I just kind of wanted to give an overview, a visual for you to look at. I'd like to touch on the environmental accessibility and home vehicle modification one. This is for individuals who need modifications to their homes. I found in my experience that a lot of people know that this is available. For people that have mobility support needs or need home modifications, there is funding available through DMH, through this waiver and the community waiver, which we'll go over next. They just changed the rules on the regulations on this. And this says that you can have a project can be up to $20,000 in supports, but you can't ask for another modification for 2 years. So you can get a pretty big project done, such as like a bathroom remodel, have like a roll-in shower put in, door widening, ramps, Hoyer lifts, stair lifts, maybe to a basement, to ensure that an individual can access their basement or a different level of the home safely. Just a lot of things available under that specific line item. There's therapy services on here. There's assistive technology. There's ABA support. So a lot of really good supports available under this waiver. The next tier down is the community waiver. So the community waiver, as you can see, has a little less services. This one does not pay for residential care 24/7. This is mainly for people who are still living in what we call natural home, which we had talked about earlier, where they're living at home with a caregiver, brother, sister, mom, dad, whomever. And this waiver caps out at about $40,000 a year worth of services. So each of these services on here, if you want to access them, the justification has to be in that ISP that you write with your case manager. So you have to say why you need these services in that ISP. And then each one of these services has their own line item on the individual's budget. So each of those line items on the budget have a unit rate, and then there's a total amount for the year. So that's how we come up with that $40,000. There can be potential, there can be some exceptions to the $40,000 rule. You can go above it as long as there's justification in the plan. So there has to always be justification in the ISP. I liken it to like going before a judge and jury. Like there are people that review these plans, that review the budgets, that review the services and determine need. So you have to do a really good job of justifying why your loved one needs access to these supports. Because DMH, they have to be, they have to be good stewards of the money. And so they need to make sure that that justification is there. The next waiver is the Partnership for Hope waiver, and our friends at the Productive Living Board help support this waiver. This one has the services that are listed, and it caps out a little over $12,000 in supports annually, and that is a hard cap. It's a little under 13, little over 12. Don't ask me to, can't remember the exact number off the top of my head. But this one caps, that's a pretty hard cap on this one. If you need supports for the plan year above that amount, then we would ask for that community support waiver. There is another waiver that I did not put up here that I think it's important to mention. It's called the MOCDD waiver, and that's for kids specifically. And that is for kids with very, very high support needs who are under the age of 18. There's a very limited amount of those waivers statewide, approximately 300, give or take. what those waivers give you access to most of the things available in the community support waiver. The difference is those families have to have a high medical, have a high need, not necessarily medical, but oftentimes it is medical. High support needs for their child. They have to maintain private insurance. They have to have either a denial for Medicaid or a very, very high spend down amount of money. And again, if families are wanting to access those services, we'll talk at the end about who can help them get access to those supports. So residential supports is something I wanted to also touch on this evening. It's something that a lot of people like to talk about. They don't necessarily know what's out there. So what are the options and how in the world do you access them? So we have community and funded supports, we have independent living, and then we have pre-independent living. So it's important to note that community and funded supports, the community and funded supports that I'm going to speak of, those are typically paid for by either Medicaid dollars, Medicaid waivers, Social Security benefits. Some of them can be private pay, but it's important to note that oftentimes those are quite expensive. So that's up to the prerogative of the family if they can afford that type of arrangement without accessing it funded through like a different funding stream such as Medicaid or a waiver. Independent living is exactly what it sounds like. This is an individual living in the community on their own. There's no staff in their home 24/7, but they can access staff that push in and help them. But there's not a designated staff in the home 24/7. And then pre-independent living, that is for individuals who are still living in natural home with like mom or dad, and they're wanting to maybe move out on their own. They can start working on skill development after they graduate high school for a couple years. And we're going to talk about those in just a second. So the pre-independent and independent living, also known as ISLA or supported living, those terms are used interchangeably. The focus of these programs is to teach life skills, okay? So we're not coming in and doing for the individual, we're teaching them the skills that they need to either move out on their own or to maintain their independence, depending on what program they're in. So pre-ISLA is post-graduation, still living in a natural home. It's in-home supports, and I believe this is a typo. I believe it's 2 years of funded support prior to moving out of their home, and it's funded through the Productive Living Board. Here in St. Louis County specifically, and there are 6 local providers that provide those supports. So again, so you don't necessarily have to have a case manager through DMH to access these supports, but you do have to have a developmental disability. So you do need to meet that developmental disability criteria that I spoke about earlier in order to access these supports. These supports are free. They are, if you have a developmental disability and you're a St. Louis County citizen, and the individual is out of high school and they want to work on life skill development while still living at home, this is your program. After that, so if they've mastered those skills and they've moved out on their own, they can access ISLA supports, also known as supported living. This is for adults who are living independently without staff or support in the home. This is someone that's living in their own apartment, their own small home. They might have a roommate that they share costs with. They can access up to 10 hours of support weekly or 50 hours a month maximum. So these are some of the areas that the ISLA support staff help with, and there are 5 local providers in St. Louis County. Again, this is to help an individual gain the skills they need or maintain the skills and help them maintain their independence living on their own. Again, this is a free service. You do not have to have DMH case management to access this. You just need to have a developmental disability and be an individual residing in St. Louis County. These services are also available in other areas of the metro area, such as St. Charles County, St. Louis City, Jefferson County. So this is another like kind of breakdown of other living arrangements, but these all have 24-hour supervision, and most of them are funded through a combination of Medicaid and Social Security benefits. So I've listed these in the order of kind of what we would say most restrictive to least restrictive environments and who funds them. So we have ISLs, which we talked about in that comprehensive waiver. So typically people will refer to these as a group home. Group homes and ISLs are not the same thing. An ISL is typically a home in the community. You're not necessarily going to know that it's there. They're very discreet in nature intentionally. We want individuals who reside in ISLs to be active members of their community. That's why we don't put signs on there. We don't say what agency is supporting them. They just live in a regular home or apartment. Typically, they're staffed one-on-one, or maybe one staff per 2 to 3 individuals, depending. Those are funded through DMH, through the Comprehensive Medicaid Waiver. Moving on to the next one is a host home or shared living. So this is when an individual with a developmental disability actually moves in with a caregiver. This is funded by DMH as well through the Comp Waiver. And this is kind of like, not quite, but sort of like a foster care, where the individual actually moves in with an individual, and that individual then gets paid to provide the care. They become a member of their family. There's also ICFIDs, intermediate care facilities for people with developmental disabilities. That's governed by Department of Health and Senior Services. There's assisted living. That's also governed by Department of Health and Senior Services. The staffing ratio there is about 1 staff per 20 individuals. So the individual needs to be fairly independent to live in an ALF. They also have to pass a screening to say that it is safe for them to live there and that they meet the criteria, which a licensed administrator will make that determination. Then there's also RCF. So that's residential care facilities. Staffing ratio there, state minimum standards is 1 staff per 40 individuals. Those are also governed by Department of Health and Senior Services. Oftentimes at RCFs, I mean, we see a variety of individuals living there, folks with developmental disabilities, and sometimes folks that have a mental health diagnoses will reside in an RCF. So how do we pay for all these things? So how do we afford to live away from home? So we talked about there's Medicaid benefits, like those waivers, and then some people qualify for Social Security benefits, and then other people work. People might also have access to trusts that they have, special needs trust, an inheritance, whatever that might be. But these are the primary ways that people access funding for living outside of their natural home. So now moving on to family navigation. So I kind of mentioned in the beginning of this that my community title is a family navigator. I am one of many. I'm very fortunate to be part of an amazing team of individuals that is out there trying to support people in the community that have developmental disabilities and educate them on all of the things that are available. So I am technically funded through the Family Navigation program. I work at Sunnyhill. There are 3 other providers that also do family navigation. And our job is to sit down with families and help them navigate through all the things. So family navigation, we provide information on systems navigation. We provide resources. We do a ton of advocacy training. We support people in completing documentation. So that might be Medicaid application, food stamp application, walk them through how to apply for Social Security benefits. Our job is to handhold if necessary, to spoon feed information to individuals if necessary, to tailor our services to that individual and what they need. So there's four agencies that provide family navigation supports. There's Easter Seals, there's St. Louis ARC, there's Sunnyhill, and then there's UCP Heartland. And it's important to note that all of these agencies work collaboratively, kind of as one body. So even though I work at Sunnyhill, I am extremely neutral in the supports that I give, and I'm going to refer families to whomever is an appropriate resource for them. It's very important that families have provider choice, that they're educated on what agencies and what services are available for them. So we should never be pushing our own agency's services unless a family specifically asks for them. But it is completely up to the families who they choose for whatever supports they need. So another thing I wanted to talk about is the Gateway IDD Resource Guide. So this is a resource that has been developed through a lot of talks, a lot of conversation. There were several of us sitting around trying to figure out how in the world we house resources, where to put them all. There's all these things out there, right, that people don't know where to get information, who's the gatekeeper for it. So a young woman who was doing family navigation supports came to our group and said, hey, what if we created this Google site website? So out of that was born this IDD Gateway Resource Guide. It's important to note that this website lives on the PLB's website. It is owned and operated by the Productive Living Board. And so all of the information on there, they oversee all of the information. So there's information on this site about funding systems, funded supports, tons of other resources, food insecurity. It's kind of a one-stop shop to go over all the things. It breaks down the difference between Medicaid and Medicare. Talks about the ISLA supports, the pre-ISLA supports, talks about how to access DMH, talks about how to access services through vocational rehabilitation for employment supports. So it's kind of a one-stop shop. And if you're looking for it, you can go to the Productive Living Board's website under their Get Information tab, and that's where you will find it. Kind of wrapping things up here. These are the people who provide family navigation supports, as I mentioned. So my name is Tamico Jones. I'm the one here at the top. I do family navigation for Sunnyhill. This is my email address and my direct phone number to my office. Emily Love is the family navigator for UCP Heartland. And then over at Easter Seals, we have Tiff King and Randy Schreier. They are both adult navigators. Over at St. Louis ARC, we have Leanna Sanders, Hannah Satterwhite, Kate Carr, and Ann Mangelsdorf. And as you can see at St. Louis ARC, they have their navigation team broken down by ages, which is pretty awesome. But myself, I think it's important to note, Tiff and Randy do adult services at Easter Seals. And then myself and Emily do all ages. As far as the supports that are offered through family navigation, all the agencies do things a little bit differently. Easter Seals is primarily, their services are accessed via like Zoom meetings or in their office. UCP Heartland and myself, we are kind of all over the place. We will meet people in their home. We will meet people at a local coffee shop, in office. It doesn't matter, whatever works. And I believe St. Louis ARC does kind of a combination of both. So that is about the end of my presentation. It's a little under an hour, but kind of a lot of information to digest.
Thank you so much, Tamico. I'm going to just let your screen stay up here for just a few minutes to see if we have any questions or if anybody wanted that. Everyone will get this information who registered through our Acuity. So you will receive the Family Navigator flyer, the Gateway Resource flyer, and all of this information. Again, I think it's good to remind families where the funding for this wonderful service of family navigation comes from, and that is from the Productive Living Board. And so it is of no cost to the family to access these wonderful community agencies that have a lot of other services besides family navigators. These are the ones that provide most of the services that Tamico discussed tonight, the ISLA services, the pre-ISLA services. They would provide the in-home supports for a lot of these things. So these are the agencies that work with families. There are others, and if you go to the Productive Living Board, they have a list of all of the agencies that they grant fund, and you can also get the information from the regional office and DHSS for the services and supports and agencies that they provide funding for.
I forgot to mention, and I hope you don't mind me interjecting,
Mm-hmm.
that we will also work with families if they don't necessarily have an official diagnosis of a developmental disability. So if there is a suspected developmental disability, we can absolutely work with families. We can help refer them to someone that can complete a formal evaluation. The PLB is really gracious in allowing us to work with those families and continue to work with them if they're working towards a diagnosis. And this is also available for families that do and do not have case management support through DMH. So truly anyone in St. Louis County and really beyond. Family Navigation is also technically funded in St. Louis City, but we're not going to turn people away. So if a family in an outlying area or Jefferson County, St. Charles County wants to access navigation services, we will absolutely help them. We are not going to turn anyone away because they don't live within our funding area. That's not what we're about. We are just here to help. There's no strings attached to our support services. There's no gimmicks. It's just, we understand how stressful and how hard it can be to navigate the myriad of services and red tape and paperwork. And it's overwhelming. Families are trying to just get through the day to day. And so we're here to kind of take some of that burden, take some of that off of families and really get them connected with all the supports that they need.
Thanks. And you can also reach out to us at the Family and Community Engagement Department at SSD. We do a lot of the same things that the family navigators do and help families really figure out how to navigate the complex educational and community resources that we have here in St. Louis County and in other counties. So you can find us on www.ssdmo.org/face. We have a common email, face@ssdmo.org. You can email us and one of us will get back with you, or you can call the main FACE, our Family and Community Engagement number at 314-989-8460. And we can help you find community agencies that could help or point you in the right direction for some of these funded services and some of the other questions that families have about Tamico discussed the Special Needs Trust, ABLE's account, supported decision-making, charting life course issues. So give us a call if you need some help or assistance. We thank you for attending the webinar this evening. I still do not see any questions, so we're going to end this tonight, but please complete the 5-question survey at the conclusion of this webinar. We really value your feedback, and we use it for ongoing programming and making decisions about how we are going to move forward and support families. So, Tamico, thank you so much for being with us this evening and giving up your evening. I know that you have a busy family life and you were with SSD people all day. So thank you for being here tonight. So thanks for attending. Come back and see us again at the next webinar, or check out our lunch and learns that are either archived or live. So thanks and have a good night.